infections in humans. So that's why this AMR issue is a very important thing, because you cannot see it, unlike HIV and AIDS or malaria or tuberculosis. It's something that is killing people silently. That's why we call it a silent pandemic.
Oh yeah, it is a pandemic, a big pandemic, because sometimes when you're not well, you rush to the hospital probably to get some medicinal drugs, but people actually don't understand that we have people whose condition refuses to take on those drugs to their rescue. So now, what are the drivers of antimicrobial resistance, and how can we actually mitigate antimicrobial resistance?
Okay. So before I delve deeper into the drivers of antimicrobial resistance, I just want to give a brief statistics of why this issue is very important. So globally in 2021, 4.7 million deaths were associated with this issue of antimicrobial resistance. And then that same year, we also experienced 1.47 million deaths directly attributed to this issue of antimicrobial resistance. So in Zimbabwe, in that same year, 2021, we experienced 3,220 deaths directly attributed to antimicrobial resistance. And then we experienced also 13,500 deaths associated with this issue of antimicrobial resistance. So in terms of the drivers, I would like to classify them according to the One Health approach, because we have the animal health, we have the human health, and we also have the environmental health. So what is this One Health thing that I'm always talking about? So One Health thing, One Health approach is actually an approach that recognizes the interconnectedness of the animal health, the human health, and the environmental health. So this is a good approach that helps us to solve complex issues within the healthcare sector. So basically, within the animal health, these antibiotics are being used as growth promoters. You know, for example, people who are in the poultry farming, they want to come up with those, you know, big chickens so that they sell to their customers to make more money and also to please their customers. But it's actually a major driver of antimicrobial resistance. We also have poor hygiene and sanitation, where we don't have like enough equipment to ensure that we are using clean utensils when we are eating, when we are doing whatever we are doing at home. So those on its own is actually an opportunity to increase infections and cause diseases within animals. Then there is lack of diagnostics, and usually within the animal health, they don't have you know, enough regulatory procedures that manages how those antibiotics are used within the animal health sector. So they end up, you know, self-medicating. And then within the humans, I'm talking now about the human health, there is what we call genetic evolution that happens within these microbes. So they've been there for billion years ago. So naturally, they do what we call natural selection as a way of surviving, you know. So that on its own has nothing to do with antibiotics. So those are the approaches that they use to become resistant to those antibiotics. And also those microbes, they do what we call horizontal gene transfer, where they transfer these resistant genes from one microbe to another. So there is also an issue of patient to physician pressure, where patients come and pressurize these doctors to prescribe antibiotics. So because these medical doctors or clinicians, they might be afraid of losing their clients, they end up prescribing those antibiotics for reasons that are not correct. So basically, this on its own is actually a driver of this antimicrobial resistance.
All right, so I think we've come to appreciate so much of the drivers of this condition, and I'm glad that you mentioned the numbers in 2021 that are skyrocketing, and also highlighting the importance of consuming organic foods if it's not genetic. And I do believe that there's more that people can learn, because it's a very crucial issue. So now you have a conference that is taking part, where people can come, probably if they're invited, to hear much more about this and to understand. So tell us more about the upcoming Zimbabwe National Antimicrobial Resistance Conference that is set for next week.
Okay, so this is going to be the first national AMR conference where we are collaborating with the different sectors within the healthcare and the non-healthcare sector. So basically what we want to try and achieve is to make sure that each and every individual is included, because this issue to do with mitigating the threat of antimicrobial resistance requires everyone on board. So we are trying to bring all the different sectors to be on the table. We discuss the issues that are affecting us at grassroots and also at a national level, so that we come up with meaningful policies, meaningful strategic interventions that are going to bring change that we are looking forward to happening in our country. So basically, each and every individual who are in the pharmaceutical manufacturing, the nurses, the medical doctors, the pharmacists, vendors, logisticians, etc., because those are the very responsible people that are using that are dispensing, using these antibiotics and also dishing them to the general public.
Oh, yes, that's very true. So thank you very much for joining us. That is very informative, and we do really appreciate. So the conference will be happening next week, and we hope more people will be getting in touch. So this is Ngoni Muzondo, joining us in the studio to talk much more about the National Antimicrobial Resistance, as well as the conference that is coming up next. Now, coming up, we take a look at